one of our top stories, the federal government is under pressure not to follow other countries and implement travel restrictions on arriving Chinese travellers by business groups, universities and the tourism sector. And to talk through this with me now is infectious disease specialist, Associate Professor Sanjaya Senanayake. Sanjaya, it's so good to talk to you again. In Italy, testing of a Christmas Eve plane load of arrivals from China in Milan found 62 of 120 passengers, so half tested positive to COVID. Italy has made testing mandatory for all Chinese travellers. If most planes from China are coming into countries with half infected with COVID, say here in Australia, what would that do in terms of Australia's wave and spread of the virus, do you think?
Well, hopefully, Kenny, potentially not too much. So if you think back to the start of the pandemic, it was a different circumstance. Many of us around the world, most of us had never been infected with COVID. There was no natural immunity from COVID, therefore, and we didn't have the vaccines to provide the vaccine-induced immunity with COVID. And in those circumstances, with closed borders, letting in large numbers of passengers with high proportions of COVID would have been, would have changed the face of everything. But now, Kenny, we know that for the last year, Omicron has dominated the COVID landscape. And now they're about this, what we call a COVID variant soup, with around 500 subvariants circulating around the world. China, the ones that's dominating, BF.7, has been found in other countries like the UK and India, and it hasn't dominated their landscapes in terms of the other COVID subvariants. So really, in a country like Australia, where we're having lots of COVID already, we've got hybrid immunity, it really shouldn't change the face of what's happening here if we let people in from China.
And that totally makes sense. But the big question is, why are other countries restricting travel? And why is our health advice different to them? Is it just because the situation here in Australia with our immunity and vaccines is different to, say, Japan, the US, parts of Europe, including Italy, who have brought in these travel restrictions on Chinese travellers? Because a part of it, reasons why they say that they're implementing these travel restrictions is because they're getting not much data and not much information, reliable, credible information coming from China in terms of what variants are circulating and how bad the outbreak is actually there. So are we just more trusting of data from China? Why are we different to our health advice here to these other countries?
Well, I guess a couple of things, Kenny. I mean, we're not a standalone country here. At the moment, Singapore, which has managed COVID very well during the pandemic, it hasn't imposed any restrictions either. So it's not every country in the world that's doing it. And the second thing is, if you look through the history of this pandemic and its management, different countries have done different things. They've responded in different ways, and not always thinking through the same points as we were talking about earlier. So I think just because someone else is doing it doesn't mean we have to do it as well, because overall Australia's managed the pandemic quite well. So on the basis of what we were talking about, I don't necessarily think we need to do that. But what I think is important, surveillance is important. Now, whether you do that in terms of testing people with PCR tests when they come in from China, just to see what variants are around, or as some people have suggested, the waste from those planes when people have gone to the toilet. You can do PCR testing on that and work out what variants are there. That would be useful.
Yeah, so identifying what variants are circulating would be beneficial to the medical community. And it's also, we're not monitoring other planes coming in from other countries. I mean, you know, there could be half infected coming in from other countries as well, but we just don't know because we're not testing those particular planes. So it might be a bit rough to single out one country, isn't it?
No, exactly. And in fact, even the US, if I'm correct, they're only putting this in place, I think, from January 5th. So there may be a lot of traffic from China before then anyway. So I think we are in a situation where we have to learn to live with COVID. Now, that doesn't mean that we're blasé about it, and if some horrible new variant appears, we don't respond accordingly. But on the rationale that I've described, that it's Omicron everywhere, different variants. The supposed dominant variant in China isn't dominating other parts of the world where it's present, like the UK and India. It would be reasonable to pursue the policy Australia is doing at the moment, Kenny.
Sanjaya, Senanayake, so good to chat with you and Happy New Year.
You too, Kenny. All the best.
Speak to you next year.